Thank you for the opportunity to give a talk at the Netherlands African Studies Association Conference 2020. I would like to express my gratitude to the association as well as to the organizers. I am going to talk about coronavirus in Ghana and its impact on society and academic life. But first of all, we need to ask ourselves how coronavirus started in Ghana. In January, the Ministry of Health had issued an alert to almost all the regions in the country that there was an outbreak of coronavirus in China. On the basis of this alert, measures were put in place at the airports and other entry points into the country. The purpose was to ensure that coronavirus never arrived in the country. But by the 12th of March, Ghana had recorded its first 2 cases of coronavirus. As a result, the country had to take measures in order to ensure that numbers never went up. But despite the measures that were put in place, the numbers of infections continued to increase. As a result of that, in March, the president decided to put the country under lockdown, specifically on the 30th of March, amidst some conditions like the observance of certain protocols associated with coronavirus. But the lockdown was limited to the Greater Accra region as well as to Kumasi metropolitan area. The issue is that these were areas with high populations, and during the outbreak, these were the areas that the disease was concentrated. But then, the lockdown also brought some unintended consequences, which was that migrants that had moved into Kumasi and Accra as informal workers had to return to their villages or to their respective regions. And this was one of the reasons by which the disease also got to other parts of the country. As time went on, it became very evident that the figures were going high, but then limited, as I've indicated, to the Greater Accra region and then to Kumasi. On the basis of this, some form of consideration was given to the way and manner COVID spread in the country. And so the president addressed the nation a number of times, indicating the way and manner the disease was spreading, the way it was being treated, and that on the basis of that, there was a need to reconsider the ban that was imposed in Accra and then Kumasi. As a result, beginning from April to about June, some of the restrictions were slightly modified to allow people to move in and out. But there was other reasons behind the modification. Actually, some were of the view that the modification was as a result of the fact that the country was performing poorly as a result of COVID. In other words, the economy was suffering. And so there was a need to kickstart the economy by lifting or modifying some of the restrictions. Another reason that was given was that we had people in their final year, we had students in their final year in the universities, in the senior high schools, and in the junior high schools. And they needed to complete in order to progress to the next level or to find jobs. So based on these factors, the government decided to ease the restrictions on COVID. And so by the time of total or let me say, 80% lifting of the restrictions, Ghana had recorded about 48,055 cases and had 47,169 recoveries with 320 deaths. So once about 80% of the restrictions were lifted, people became more comfortable to move about. And then in the process, we are beginning to think or to see that figures are coming up again, according to the Ministry of Health. But to what extent has COVID affected academic life? As somebody teaching and researching in the University of Ghana, the outbreak of COVID and the restrictions affected my work and my students in two ways. First has to do with teaching and learning. The fact that restrictions were imposed meant that I could not have face-to-face lectures or interactions with my students. Everything had to be migrated online. And of course, this was the first time that some of us had to deliver our lectures online. The problem was not so much about having to deliver the lecture online, but the major problem was the issue of accessibility of whatever you were delivering to the students. Because it wasn't all the students that had laptops or smartphones. And even those that had laptops and smartphones, it's not all of them that could afford data. And for those who could afford data, there were others that were located in some parts of the country that internet connectivity was very slow. So to say that teaching and learning was entirely or completely successful under COVID, I will say it was not entirely so. Even though at least about 80 to 90% of the delivery was well received by the students. The second area that COVID affected my work had to do with the issue of research. Most of the researches that I do has to do with me physically going into communities and talking to people, mostly orally based. But the fact that restrictions were imposed meant that I could not travel to some places in order to conduct interviews. As a historian, there's a need for me to be able to ground my discussions using archival sources. And here too, because of the lockdown, it became almost impossible for me to be able to go to the archives. And so in a way, both in research and teaching, my academic work was a little bit affected. But in terms of research, I would like to say that as a result of the restrictions or as a result of COVID, I had to redesign some of the themes that I intended to research into, and therefore had to come out with topics that I could research without physically going into places. So for example, the issue of religion became very evident during COVID restrictions. Most of the religions, Islam, Christianity, and traditional religion, went about online. And so I was able to pick some of the themes that I wrote about from some of the social media platforms and interactions. This has enabled me to be able to write 2 blogs, one for the African Studies Center on the effect of COVID on society and academic life. Another also was on religion, especially traditional African religion and COVID, the interventions that were put in place by our priests and priestesses. Through social media, I was also able to write a blog which is hosted by the University of Utrecht on the intervention by priests and priestesses during COVID. So in short, this is my experience with COVID and in part the experience of Ghanaians. Thank you very much for your attention, and I wait for your questions and comments. Thank you once again.